5 blood tests to check if you are feeling generally tired. First would be full blood count. Full blood count checks for hemoglobin levels, so it will help to identify anemia. It also checks white cell count, and any abnormalities in white cell count could help the doctor pick up early signs of some cancers. And it also checks platelets, which if raised could also be a sign of some cancers, which we know that present with generalized tiredness. The second blood test to request for is thyroid function test. Any abnormalities in the thyroid function could present as generalized tiredness, specifically if in an underactive thyroid. The third blood test would be to check for vitamin deficiencies, particularly vitamin B12 and vitamin D deficiency. If either of them are low, then it could also present as generalized tiredness. The fourth blood test would be to screen for diabetes. So checking HbA1c helps the doctor to screen for diabetes, and which can also present as generalized tiredness. The fifth blood test would be to check for the general health, like the metabolic health of the liver and kidney. So it is done by a liver function test and kidney function test. So if you are feeling tired, get these blood tests checked, speak to your doctor about it. There could be some more other tests which would be added by your doctor depending on what other symptoms you are also presenting, but these are the tests generally requested first if you are feeling generally tired. If you want more such important health content, please follow and like my channel and subscribe. Thank you.